Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communication specialist with Quality Insights. Today's webinar topic is Staying Current, Key Updates for Immunizations and Healthcare Reporting. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is Post-COVID Care in Nursing Homes, What You Need to Know. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our speakers today, Jennifer Brown and Debra Wright. Jennifer Brown is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Debra Wright is a quality improvement specialist at Quality Insights. She joined the Quality Insights team after being in the long-term care industry for more than 30 years. She has a wealth of experience in long-term care nursing and management, ranging from certified nursing assistant to vice president of healthcare operations. She's most passionate when working with the MDS process and quality improvement. Jennifer and Debra, thank you for joining us today.
Thanks, Kathy.
Thanks, Kathy. Welcome, everyone, and thank you for joining us here today. We're here to talk about some updates that might impact how we care for our residents, manage our data, and report information about our communities. As we all know, the changes that have been happening, they're kind of hard to stay on top of sometimes. So we just want to go over some of the recent changes that we've seen and answer any questions that you guys might have about that. So some of the changes that we've seen recently do relate to the immunization guidelines, MDS requirements, and there are going to be some upcoming NHSN reporting. I know we just saw some in September, but we're just trying to keep on top of that because it can seem like a moving target sometimes. But with these updates, it gives us a chance to improve on the quality of what we're trying to do here in the facility. So today's session will be really straightforward, practical, and we'll go over some steps that we'll need to look at over the coming months. Okay, so let's just dive in on some of the updates on immunization recommendations. So the first update that we'll discuss is for COVID-19 vaccine timing. For adults age 65 and older, the latest recommendation is to get 2 doses of a COVID-19 vaccine for the 2024-2025 season. So this can be with any of the options available, the Moderna, Novavax, Pfizer. Most facilities have already started vaccinating their residents with the 2024-2025 vaccines. However, there has been a recent update, and it's now recommended that adults over the age of 65 receive a second dose 6 months later to reinforce protection. So there's one key exception here. If someone in the age group is unvaccinated and starts with Novavax specifically, the CDC recommends that they get a second dose of the Novavax, and then after 6 months, a third dose of any COVID-19 vaccine to ensure strong immunity. For this third dose, they'll need to wait at least 2 months, but recommended 6 months, for the dose. And that is to, like I said, just to help boost immunity for older adults who are at higher risk for severe illness. For influenza vaccines, just as a reminder, over the summer, the CDC has updated its flu vaccine recommendations for this current season. And the guidance is pretty straightforward here. Everyone 6 months and older should get vaccinated unless they have a rare exception. The 2024-2025 flu vaccines have been updated to be trivalent. They'll cover the H1N1, H3N2, and the B Victoria lineage viruses. So that means that, they'll be protected from these with the trivalent. And then for adults, for individuals ages 6 months to adults age 64 years, they can be given any available age-appropriate influenza vaccine product. However, for adults age 65 and older, there are 3 recommended vaccines. The high-dose inactivated influenza vaccine, so that'll be like the Fluzone high dose, the recombinant influenza vaccine, Flublok, and the adjuvanted inactivated influenza vaccine, or the Fluad. So those are the recommended ones that will affect most of our residents in long-term care facilities. Another important update to vaccine guidance is the pneumococcal vaccine. For this vaccine, it covers pneumococcal disease, which is a common cause of pneumonia, also very common for bloodstream infections, meningitis, sepsis, in older adults. So this vaccine is often administered alongside the flu vaccine in the fall, but can be given at any time throughout the year as residents become eligible. So for this year, the CDC has updated the guidelines to recommend the pneumococcal vaccination for children younger than 5 years, and also for adults 50 years and older. So previously, it was recommended more so for adults age 65 and older across the board, and then, younger residents if they had certain comorbidities. But now across the board, 50 years is the recommendation. So for some of the facilities that might have, a younger population, that might affect you guys more. So this is a image of the new pneumococcal vaccine timing, a nice little job aid that the CDC has put out. And it helps give like a visual representation of which vaccines are recommended. This will help integrate pneumococcal vaccine into your practice. So for people who have never had the pneumococcal vaccines, adults age 50 years or older, they're recommending either the PCV20, 21, and for those, it is a one-time dose. Or you can opt to have the PCV15, and then a year later, the PPSV23. And then it, has some recommendations for people who have started the series, which doses are recommended after that. So a little about the PCV21 vaccine. The pneumococcal vaccine recommendations have been updated to recommend the PCV21 for adults. As of June 27th of this year, this vaccine is approved by the FDA and targets the strep pneumonia strains that are common in adults. And, as I mentioned, it is a single dose. So I just wanted to show you guys the available vaccines for adults. So we have the PCV15, the PCV20, PPSV23, and PCV21. So the numbers after the letters here, they refer to the number of strains that are covered by that particular vaccine. So a lot of people, when they said, oh, we have a PCV21 coming out, it's like, oh, well, it's just one more strain. But it's not really the case. So up here we have the different types of pneumococcal bacteria strains that are, circulating and are covered by our vaccines. So as you can see, the PCV20 has a particular set that it covers. when you give it to the resident. However, the PCV21 has 8 unique strains that are common in adults, and that's why some of the providers and vaccine proponents are recommending this for some of our older adults here, because we have some of these strains that are really common in adults that will provide them with some additional protection. Also, and I'm just going to skip back to the job aid that I showed a second ago. The people who have completed the PCV 13 and the PPSV 23, there is a shared decision-making model. After 5 years, you may give the PCV 20 or 21 just to give some additional coverage for those residents. However, if they have completed the series, they are considered up to date, but it's just some extra added protection that the provider might opt to administer if they think it's appropriate. So at this time, we're going to move on to some updates regarding MDS coding. So I'm going to pass the baton over to Deb.
All right, thanks, Jen. Yep. So next slide. So most of this will just simply be a review. It's all things that we have talked about a number of times. So these next 2 slides, the first one is Pennsylvania. The second one we'll show in a minute is West Virginia. And these are where you can go. They're the registries. So most vaccine providers in the community do utilize these registries in both PA and West Virginia. They are optional, but like I said, most pharmacy vendors, most doctors' offices, hospitals, they do enter vaccines into these registries. So here's the link for Pennsylvania, and next slide will show the link for West Virginia. So you can just go in there, it'll ask you a couple identifying information, and then if the registry's been used, it will list the vaccines that they've had. So a lot of people find these beneficial because it eliminates that phone call to the doctor's office that we all know it takes so much of our time to get the resident's history. So these are just some added resources so that you can get the resident's history. Next slide. So just a brief review of the MDS coding. The influenza and the pneumococcal have not changed for quite some time. So the definitions for influenza coding on the MDS, it's asking, have they received the vaccine in your facility? If they have, then you put the date. If they have not, then there's you state the reasons. They weren't in the facility during the influenza season, which really isn't pertinent right now, but come April, then that's when we would start seeing this. So if they're a new admission after April, after the flu vaccine season is over, then you would code that if you couldn't find their history or they didn't have it. Received outside of the facility, this is where you would code if they received the vaccine in the community or another facility prior to coming to your facility. And then you have all the other ones, whether they were contraindicated, they offered and declined, not offered. We don't really have it this year, the inability to obtain influenza vaccine due to shortage. That's not an issue right now, or none of the above. So those are all pretty straightforward. Next slide, please. Pneumococcal, it's simply, are they up to date or not? And remember what Jen said, that if they've had the 13 and 23, they are considered up to date, even if it's been 5 years later. So even if it's 10 years after they've had the 13 and 23, they're still considered up to date. Now, you would want to have that shared decision making, and you would want to talk about, are they eligible or interested in the 20 or 21, but they are still up to date. If they say no, they're still up to date because that is the definition of up to date. If they're not up to date, then is it that they weren't eligible due to a medical contraindication, offered and declined, or not offered? And then the next slide, oh, sorry, I missed that. Oh yeah, the next slide. here are some resources that Quality Insights has created to assist you with the algorithm. I know a lot of RNACs that have this printed and up on their bulletin board in their office, just kinds of walk through, okay, if they've had this, what are they due for? The other thing that's on here is a app that's available that you can put on your desktop or your phone or whatever, and it asks you the date of birth of the resident, and then have they received this type of pneumococcal vaccine, and it kind of works through, and once you have all of their history in there, you click enter and it tells you if they're up to date or if they're due for something else, kind of as a second check to see if they're due for something. It's not going to give you their history. It's just walking you through, are they up to date or not? Next slide. So this is the newest change to the MDS coding, and this went into effect in October, and we now have to code the COVID-19 vaccination status of our residents. And it is simply, are they up to date or are they not up to date? There's no questions as far as why are they not up to date. They really don't, I say this loosely, but they really don't care why they're not up to date. It's they either are or they're not. So you would code no if they're not up to date, including any of those residents that have refused the vaccine due to medical or religious or other exemptions. You would code that they're not up to date. And if they are up to date, meeting the current CDC definition of the 24-25 COVID vaccine, we would code yes. And a dash is a valid response, but they do expect that to be a rare occurrence. And then on the next slide, we just have some our COVID vaccine toolkit with up-to-date resources, things you can post throughout the building, you can include in your admission, readmission packets, use as part of your education for your staff and residents, as well as the infection preventionist to see another algorithm to see if they're up to date with their COVID vaccine. I think that is it for the MDSs. What's the next slide, Jen?
Yep. Next week.
So
Yeah.
good old reporting changes to NHSN coming.
Okay. Thank you so much, Deb. The next thing we'll talk about, our final update we'll cover today, is the changes to NHSN reporting. So beginning in September 30th of this year, there were updates to sort of streamline the reporting of long-term care facility, resident case, hospitalization, and vaccination data in the respiratory pathogens and vaccination module. So on November 1st, CMS issued a new rule requiring long-term facilities to report resident information about COVID-19, influenza, and RSV starting January 1st, 2025. So this reporting will be required on a weekly basis through the NHSN system. This updated requirement will replace the current COVID reporting requirement for staff and residents. And I know, up until this point and currently, the reporting of RSV and flu has sort of been optional, but it will be mandatory come January 1st. So the data elements which NSHN reporting will be required on the first of the year next year would be the facility census, the resident vaccination status for COVID-19, influenza, and RSV, and also information on illnesses at the facility that will also need to be reported, such as confirmed resident cases of COVID-19, influenza, and RSV, and that'll be overall and by vaccination status, and then hospitalized residents with confirmed cases of COVID-19, influenza, and RSV. So those are just some updates that we wanted to provide for you guys. There will be some upcoming training provided by the CDC on the long-term care respiratory reporting on December 11th, and we'll share that link with you. If anybody has and I'll drop the link for this. Anybody has any need to go back and look at some of the previous reporting that they had, they do have the slide decks for the previous trainings on there. So I'll just drop that link now. On January 1st, 2025, that will be the effective date for reporting, and mid to late January 2025, the new data will be posted on the NHSN website. So some of the things that we can do to just prepare for this, just make sure that your policies and procedures are updated to be consistent with the new requirements. If you need to look at your surveillance data, you know, making sure that you're capturing all the new cases for flu and RSV in addition to your COVID, and take a look at your emergency preparedness plan as well. That might be impacted by the changes as well. So at this time, we'll take any questions. Look and see.
Jen, there is one in the chat. A facility's been offering the PCV 20 and they're questioning, should they start offering the PCV 21 instead?
It's really up to you as a facility. Both are options for pneumococcal vaccination. It really depends on the prescriber, which one they prefer, which one they think would be the most benefit for your population. So PCV 20 is, you know, great. It's perfectly acceptable, you know, vaccine to offer to your residents. That's one of the recommended vaccines. But PCV 21 was also given as an option for those who might be, you know, interested in offering that as well.
So we have a hand that's raised in the chat. April, I've given you the ability to unmute yourself to ask your question. Or you could lower your hand if you don't actually have a question. Sometimes people hit that button by accident. Okay, while we're waiting, we've got another question in the chat. It says, can you clarify the COVID 24-25 vaccine? I thought the second dose was only for those immunocompromised.
Yeah, so that's the new update. It's for anyone over 65. They're recommending it a second dose. So.
All right, thank you. And that is all the questions that we have so far. So if anybody else has a question or comment, please submit it using the chat, the Q&A, or raise your hand if you'd like to ask your question out loud. And while we're waiting, I'd again like to invite everyone to next week's webinar, which is on post-COVID care in nursing homes. That will be the same time and place next Wednesday at 2 p.m. And you can find the links to our webinars in the newsletter we send out. Not every Friday now. We are going to go with bi-weekly starting, I believe, November 22nd will be our next edition of the Last Minute Lowdown. So if you would like to receive that newsletter but don't think you're on the mailing list yet, you can email me at caudill@qualityinsights.org and I will get you on that list. And in that email list, we will also send invitations to the webinars. So if you want to come to our webinars, let me know and I'll make sure that you get our emails with the invitations. Let's see, that's all the questions we have so far. So that might be it for today. Jen and Deb, do you have anything you'd like to add before we close out today?
No, thank you all for attending. And if you have any questions, please feel free to reach out to us at any time.
Thank you, guys.
All right, thank you. I will close this out then. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It's anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Jennifer and Debra, I'd like to thank you both for joining us today and for this great presentation. And I'd like to thank all of our attendees for joining today, and we hope to see you again soon.
Thank you.